Okay, here we go. I'd like to introduce Kim Searles. She's the Director of Education at Beneficent. Kim teaches business professionals how financial support can be provided for long-term care. Her work was inspired by her mother's battle with uterine cancer and her brother, who has Parkinson's disease. Kim wants others to know about how to pay for long-term care so that they can focus their time and energy on spending precious moments with their loved ones. Okay, take it away, Kim.
Awesome. All right. Thank you. Nice to meet everybody. So those of you that have your cameras on, thank you. So I can see your faces. I do like to make this interactive, and fun. So in a few minutes, I will be playing a game with you, and so just kind of join along. And I hope that you learn a lot of information tonight. And so like she said, I am the director of education. So this is my team. Can everybody see the screen okay? Okay, good. All right, so this is my team. Some of them are in our office. Our physical office happens to be in Colorado Springs. However, we serve the entire state of Colorado, even the rural areas. So it doesn't matter as long as you live in the state of Colorado, we can help serve you and your family. Okay. So some of them are of these, my coworkers are in the office. Some of them are remote agents, and they used to be in our office, but they're such a good employees, we didn't want to lose them. So they just, a few of them have got husbands that are military. So we just want to keep them as employees. So there's our team. We are here to help. And so today we are going to be talking about different long-term care options for those people with Parkinson's. Okay. And we can help anybody with no matter what progressive disease they have, whatever issues that they've got going on. If they need help with two activities of daily living, that's usually when we're turning in an application for long-term care. Okay. We also do pre-planning for people. We're going to talk a little bit more about that as well. Oh, we already talked about that. If you've got a camera, would love to see you. All right, so here's a picture of my brother and I. So he was actually misdiagnosed early on, and they thought it was essential tremors, and then it progressed from there. And then he ended up doing the DBS brain surgery in 2019. Man, that completely changed his life. So he's back to working every day. Now he's starting to regress a little bit with shuffling and that type of thing. So it's hard to see your loved ones go through this. So by show of hands, are you caregivers, or do you actually have Parkinson's? So for those of you who have Parkinson's, do you mind sharing with me? Okay. All right. And then are you a caregiver? Okay. All right. So we're going to be addressing both because we can help obviously both, but caregivers, we're going to talk about that as well. So for people, do you personally have Parkinson's? Do you
Kim,
need
I'm so
support?
sorry to
Yeah.
interrupt. Can everyone see Kim, the screen share that Kim is doing with the Beneficent? Okay, someone's having some technical difficulties. I'm so sorry to interrupt.
That's
Please.
okay. That's all right. So, and they might want to look at the Zoom options, the viewing options. Okay. All right. So, another question is, are you a caregiver for someone that has Parkinson's? And then do you need a break? Right. So this would, by us coming alongside you, it would help with that as well. So it's definitely an honor to be a caregiver. I was actually a caregiver also for my mother. My mother had uterine cancer, went through the cancer battle with her, and then she passed away 2013. So I can talk from experience. Being a caregiver is hard. And it can be stressful, but it's very rewarding at the same time. And oftentimes when it comes to caregiving, caregivers are often overworked, and it can be stressful on them. But did you know that caregivers can be paid to be a caregiver? I didn't know that when I was going through the cancer battle with my mom. So if you want to be paid to be a caregiver, we can talk to you about doing that. Or if you want professionals to come in and give you a break so you can go back to the role of whatever your role is, whether it's a spouse, whether it is a friend that you're taking care of, or sometimes we see daughters or sons stepping up and taking care of their loved ones. Like I said, you can either be paid to be a caregiver, or we can get professionals in, and then that would just kind of take some of the pressure off as well. Or if you have Parkinson's yourself, you can always call our office and we can help you walk through the process so that you can get some support, right? You don't really need to have a loved one or a friend assist you when you can have professionals come in. So you've got options, just know that. And I'm going to talk about how to get it paid for. Okay, so that's great. I do want you to know at the end of this class, you will have an opportunity that you can give your thoughts, feedback on the class. Okay. So, a lot of challenges when it comes to long-term care. People have a fear of running out of money, right? I'm sure, at least when it came to when my brother was diagnosed, he went into a panic because that was one of his biggest fears is how am I going to take care of myself in the future? What does that look like? Okay. Within an hour of us doing a free consultation, it's called a pre-planning appointment. We can answer all your questions. And so that you're not worried about what's going to happen in the future. Another challenge is the time it takes to get qualified for long-term care Medicaid or VA aid and attendance if it's a veteran. So, but we specialize in helping people get qualified so for us, it's not a challenge. And then also people struggle with payment options. How are they going to pay for it? It can get very expensive. And then also we know that sometimes business healthcare professionals are forced to turn away seniors or disabled adults because of they're not sure how clients are going to pay for the services that they're offering. We'll talk about that too. So these are the different programs at Beneficent. That's the name of the company, by the way, is Beneficent. Think of the movie Maleficent, right? The word beneficent means doing good for others. So that's our website, is doinggoodforothers.com. But at Beneficent, we specialize in long-term care Medicaid and VA aid and attendance. There are many Medicaid programs in the state of Colorado. For the purposes of this class, I am only talking about the long-term care Medicaid program. So I'm not referring to low-income insurance space, also known as Magi Medicaid. That is out there for people, but it doesn't matter what insurance people have, or sometimes people will get enrolled with Medicare. So it doesn't matter what insurance that you have, we can come alongside you and help you to get qualified for this long-term care Medicaid. It's a totally different program, and people have to financially qualify for long-term care Medicaid and physically, both. And we would help people qualify on the financial side, okay? Also for our veterans, we do the VA aid and attendance. So with the long-term care Medicaid program and actually VA aid and attendance, it helps pay for all of these services. Regular Medicaid, Magi insurance-based Medicaid or Medicare does not cover these services. So if you want to stay home as long as you possibly can, we would help you get non-medical services paid for. In the future, as things progress, if you need to go into assisted living, memory care, full skill care, or even adult daycare, any of these services can be covered with this program. These are some of the payment options. Of course, people can privately pay, and some people do. Some people have a long-term care insurance policy. So I want you to know if you have a long-term care insurance policy, we can help you. And if you don't have one, we can still help you. Okay, I don't want you to be worried if you don't have a long-term care policy, because if you don't have one, we're still going to get you covered. But if you do have one, we can actually help. That would actually help cover even more services and help you to preserve even more. So we would help you if you have an insurance plan. We'd help you read it, understand it, and know what's covered. Okay. And then also another payment option is the long-term care Medicaid or VA aid in attendance. So our veterans, do we have any veterans? Are any of you veterans or are you a caregiver for a veteran? Okay, then I'm not going to go into great detail with this. I just want you to know that we serve veterans and we do not charge for our services if they are a veteran, if they want to do the VA aid and attendance program. We do not charge for that program. These are the new numbers that came out. Basically, just so you know, if a veteran wanted to have VA aid in attendance, this program is a great program, but it's capped at a veteran can only get up to $2,300 a month. And so if they need more care than that, then we would just be talking about the long-term care Medicaid. Okay. All right. So this is the long-term care Medicaid. These are the new guidelines for 2025. Okay. So they just came out. So I did update that for this class. All right. So these are the requirements. So just bear with me. You're going to feel like you just entered a math class. Okay. So the rules say that in order to qualify, you either have to be over the age of 65, blind, or a disabled adult. So now this disabled adult, when somebody needs help with 2 activities of daily living, that's when we would turn in an application for the long-term care Medicaid. Okay, so if you're not considered disabled yet, but you need help with 2 activities of daily living, we can turn in the form with turning in also the long-term care Medicaid application at the same time. It's called an Arbor app. We can do that at the same time. There is an income cap. The income cap is 2901 unless we use an income trust. That's used when we have a Medicaid applicant that has too much income to qualify for Medicaid, but not enough to pay for long-term care. In other words, like they're going to run out of money, okay? And they're worried about how they're going to pay for care. We would just help them figure that out, okay? There's also asset limits. So asset limits are things held over 30 days. Income is money coming in every 30 days. Does that make sense? All right. So the rules say for a married couple, pay attention to my verbiage here. It says, the rules say a married couple can only have access to $157,920 the day that they apply. A single person can only have access to $2,000 the day that they apply. If you don't meet these requirements, there are strategies to access the benefits. So in other words, if people have more than these amounts, they need to call our office because we can help them to get qualified. Tracy?
Two questions that I can think of. So on the income trust, what about if someone has a Medicare or a healthcare trust in addition to an income trust?
Yep, I'm going to go over that in just a moment.
Okay.
So, yep, why don't, yep, okay. Yeah, so this income trust is, we would use that when, so this 2901, I'm going to show you the next slide here. So this next slide should be very interesting to you. Find your region. Where are you? So let's just say you're in the region 1, the Denver area, right? Region 1, what this is saying to you is that a retired senior or a disabled adult that needs care can make up to this amount, $11,556 a month, and they can still qualify for long-term care Medicaid. That's usually much more than what people are thinking. When I say the word Medicaid, do you guys think of people that with money or without?
Uh,
Right, without. Okay, because there is the Magi insurance-based low-income programs out there. This one, I want you to just think about it's separate. It's over here, totally separate. This long-term care Medicaid program, again, we would help you qualify on the financial side, but you have to qualify financially and physically. In other words, the 2 activities of daily living, that is needed, and then on the physical side, and then we would help you financially to get qualified. So I just don't want you to think that you wouldn't qualify because you make too much or have too much. Okay? All right, and we'll talk more about that in a moment. So back to this screen. Again, we would not turn in the application until you need help with two activities of daily living. But I don't want you to wait to call my office until you need help with two activities of daily living. Like for a long time, my brother, he doesn't need help, right? Especially since he did the DBS surgery, right? But we can meet with families. It's called a pre-planning appointment. We can meet with them early on so that you stop mentally worrying about how you're going to pay for care in the future. We're just walking through that process. So we are what is called CMPs, Certified Medicaid Planners. It just means that we know the rules, the regulations, the guidelines in order to help people to get qualified and get a yes and get approved. Okay. So, all right, now I'm going to play a quick game with you guys. So I'm going to give you the answers anyway on the second slide. So you guys just unmute yourself, shout out the answer, whatever you think it is, okay? All right, so the first one is Colorado long-term care Medicaid will pay for what? I already gave you guys the answer.
Yeah.
Yes, F. F, all of the above, okay? A lot of people think that it only covers like skilled nursing. That's not true. It will cover all of these things. All right, next Mythbuster is, do clients have to sell their home to pay for long-term care?
B.
Yep, the answer is no. You do not. Actually, one car and one home is exempt. You have to have an intent to return home. You can even say that I want to pass away in my home, right? They can't take away your home. So there, but we would walk you through that process. One car, one home is exempt. All right. And then also, next question is, does Medicaid always recover a home? In other words, a Medicaid estate recovery. That means after you pass away, they come back and take your home. People are worried about that. The answer to that one is no. If we can properly help you plan, like sometimes we can add a child to the home, or we can, sometimes they want to sell the home and then we'll deal with too much cash, or sometimes there's so many different things, options that we can do, and we would just give you all the options. Okay? This is a big myth. Can you give assets away in the last 5 years and still qualify for long-term care Medicaid?
Yes.
Very good. The answer is yes. A lot of people think no. A lot of people think that they can't. We should help you do it though. So this is the thing. The rules say this, when we're helping people fill out the application, on the application, the question says, did you give anything away in the last 5 years? And we say yes. Our client did, and we're helping them to disclose everything that they have. And then the state says that they have to report it. So we are helping them report it. And then we look at the monetary value of that. And then we add it up, divide it by the average cost of care in the state of Colorado. And then sometimes the state might say, okay, for a few months, you're going to have to privately pay. And then after those months are up, the state will pay for your care for the rest of your life, as long as you stay within guidelines. Okay? So, all right, this is a good one for you that are married. If my spouse makes too much money, does that mean that I can't qualify for long-term care Medicaid? I'm getting blank faces.
No.
No. Okay, so yes, it does not, the income of the spouse doesn't matter. You know, and I'll tell you this, it's interesting because the state favors marriage. I've been at some events and I've had some people tell me, actually it was at the Parkinson's event, someone came up to my booth and said, our plan is I'm just going to divorce, we're going to divorce each other. My husband has Parkinson's and he wants to make sure I'm taken care of, so we're just going to divorce each other. And I told him, stay married and call my office and let us help you plan, okay? Because the state favors marriage. And what I mean by that is if we have a husband and wife situation, the state allows us to just transfer everything over to the community spouse without penalty. They do not want the community spouse, meaning the person that's living out, like still in the home or what have you. The person that's living out in the community or the person that does not need care, they don't want that person to go poor and destitute trying to take care of and privately paying for their loved one. Because what happens to them when they need to continue to live and thrive in the community, right? So just remember that. If they're married, tell them to stay married. All right, is Medicaid only for low income and not the middle class? I think I already gave you guys the answers to that one. So no. So people, it's rare when we see people that have a monthly income coming in of $11,556. Okay. I wish I made that. Don't you guys wish you had that every month? My goodness. All right. Number 7, can clients qualify for long-term care programs if they can't qualify for long-term care insurance? So the answer is yes. So usually, like with long-term care insurance, people usually get that when they're not sick, right? And they're healthy and hope that nothing happens. Well, in this case, we're turning in the application when they need help with 2 activities of daily living. So that means they are sick, right? All right. I should ask this question. Do you guys know what I mean by activities of daily living?
Yeah.
Getting dressed.
Yes. Bathing, dressing, toileting, cognitive. Like, think about the different things that you do in the morning before getting in a car because driving doesn't count. Okay. So if you need help with, and you guys might be like my brother, he's fine right now. Okay. But in the future, he's probably going to need some assistance and he wants to stay home as long as possible. So I'll just make sure that, non-medical home care agents can come in and assist with those things. And as a sister, I could do it, but I technically can't because he's in Florida and I'm in Colorado. Right. So anyway, all right, so here's a married case study. So this is Mr. Johnson. So he is in a rehab center and he's supposed to discharge next week. Together, they have a home, they have a car, a 401k plan, and anywhere between 2000, I'm sorry, $2,020 and 200,000 in cash. Do you think you would qualify for long-term care Medicaid? Yes. So the answer is always yes. We are strategizing, how can we help someone to get approved? What does that look like? Right? Everybody's financial portfolio is so different. That's why we do the free consultation for an hour so that we can walk people through it and teach them how we would do this, right? What does it look like to get a yes? So in this case, we can just transfer everything over to Mrs. Johnson, right? Because she's the community spouse. And we transfer everything over to her to make sure that she's okay. And then we get his care paid for. So if you know of somebody that needs care and they're married, please tell them to call our office. Now, those of you that are not married, you're thinking, well, what about me? I'm single. What's going to happen to me? Okay. We have to strategize a little bit differently with a single person. So I would encourage you to call our office and we'd walk you through it as well. Okay. So our mission is just to ensure that seniors and disabled adults get the care that they need without financial burdens, right? We also want to help lower the Medicaid outcomes. So what's happening right now is if people don't know about Beneficent, let's just say they go to a hospital or rehab center and they don't know about us, and then they're discharged home, oftentimes family members step up and they're trying to help their loved one. Well, then they fall, something happens, and then they end up right back at the hospital, and it's this vicious circle thing that's happening. So if we can step in and teach them how to get care paid for, they're more likely to get the care that they need, right? And so it should lower the rehospitalization because they're getting the therapy that they need in home. They're getting the non-medical services in home. They're getting all those services, which is great. So I just want you to think about if you know of someone, whether it's yourself or if you're a caregiver that needs assistance, we can come along and help. If we are new to you, meaning if you've not heard of Beneficent or you don't know a lot about us, I want to encourage you to go on to the Beneficent. And actually, you know what I can do, Christy, is I'm going to send you an email and it's for clients that need our services. Okay. And then I want you to just pass it on to the group. And it has the links for the Google reviews as well as the BBB reviews. I want you to read some of the things that clients say about Beneficent. Usually there's a theme, and it's a theme of, oh my gosh, if it wasn't for Beneficent, I don't know what I would have done. Thank you for the peace of mind and certainty. I'm sure before taking this class, you guys were probably worried about what's going to happen to you in the future. I don't want you worrying anymore. Okay? I just want you to call our office. All right, I promised you in the beginning of the class that you can give me feedback on this class. So if you want to take out your cell phones, you can go ahead and scan that, and you can do that if you would like to do that. I will be quiet for a moment while you do that. They asked a question. It said, is that amount for one person or for a couple? Faye, what portion of, is that how much income is coming in
They were
or?
asking when, after the slide where it said you could have like up to $11,000 in the Denver area per
Yes.
month in
So like
income.
if, yeah, so remember that it doesn't matter what the community spouse member has, right? So if it's the individual needing care. So we're just doing income trust if they're in between that 2901 and the whatever region that they're in.
Are there any other questions anyone has? Now's the chance to talk to a professional who understands a lot about this. I know there's a lot of misunderstanding about some of this. Are there any other questions?
I want you to know this, that it is nice that we do the free consultation so we can also answer all those questions. I am not a case manager, so I don't answer case questions. So, but this is the way it works. You would call our office, and oops, that is our phone number to call the office. You would call our office, and then we would ask, whoever answers the phone is going to ask a series of questions. And then when we do that, we're getting so that whoever's going to handle the case when we do the free consultation, they're prepared for the meeting. And then we ask you to get some information together as well. Okay. And then so you call, we ask you a few questions, we set up the free consultation, and then we would send you the Zoom link. If you want to come to our office, you can, but again, we're in Colorado Springs. So a lot of times we do via Zoom like we are right here. Okay. And then we answer all of your questions and tell you how we would get care paid for. If you do not need help with 2 activities of daily living yet, you can just call and ask for a pre-planning appointment. You can tell them you took this class and you want to pre-plan and you don't want to worry about it anymore. Because remember I said that this on one of the questions is, did you give anything away in the last 5 years? What if you called our office tomorrow, set up an appointment, and we answered all of your questions and we told you what to do ahead of time? And you did it, and now 6 years go by and you still don't need help. And then that's when you finally need help with activities of daily living. Well, then we go help you fill out the application at that time. And the state says, did you give anything away in the last 5 years? And we can honestly say no, right? Because you were proactive and you planned ahead of time. So that's why I'm encouraging you to call my office and do the pre-planning appointment. I really don't want you to wait until you're in the firing squad and you need activities of daily living assistance, and then you call our office, right? Yes, go ahead,
Uh,
Jen.
what type of entity are you? You're not a government agency? Are you an insurance
No,
company?
no,
You a third
actually,
party
if
or?
yeah, we are a company, we're both a for-profit and a nonprofit company, both. And we've been for years working as a for-profit. So we're a private entity. Because we are a for-profit and a private entity, we can do things that, like if you were to call, for example, like DHS and try to do this on your own, I have another slide to save time. I took that slide out, but DHS tells us that 70% of applicants that try to apply on their own are denied
Mhm.
because it's missing information or incorrect information or whatever. 70% are denied. We have 100% success rate, but we're also licensed to do things financially that other companies are not licensed to do, other individuals are not licensed to do. That's why we can help families to preserve assets and keep it generationally in the family instead of whoever declines first and they just spend everything they have on that one person, right?
So if you need a trust or that sort of thing, does your company do that then?
We do some, there's some kind of trust that we do, and there's some that an attorney would have to do, right? So we'd walk you through what things we can. So we are certified Medicaid planners. We are not attorneys. We do not practice law, nor do we want to practice law. Oftentimes, attorneys will work with us because they don't want to deal with the long-term care rules and regulations and guidelines. It's about 167 pages of code
So how do you get paid for your services then after the,
from clients.
okay, so then there's a fee after the 1 hour consultation.
Yes.
Okay.
Options that are given to you. We will teach you how to do it on your own during the free consultation. We will also help you fill out, this is how you fill out the application. We're teaching you how to do it, helping you fill out the application, tell you where to take it and so on, and give you kind of like a checklist so you can take care of it on your own. If you wanted to do it on your own, we're okay with that. We will just empower you and give you the knowledge. That's one option. Another option is sometimes 1 out of 5 cases is pro bono. They have just no cash to pay us at all. And so we're looking at the financial situation, see if they can pay us. But sometimes they also have all these other resources. If those things are not input in financial order, they'll get a denial. So sometimes we'll end up doing those cases pro bono. And then to be fair to everybody, during the initial consultation, we will quote how much it will cost for us to do it at Beneficent. Because everyone's financial portfolio is different. It's not based on how much cash you have. It's based on how many transactions do my case managers have to do in order to help someone get approved. Because some people have simple financial portfolios and other people have very complex, right? People have extra, I don't know, 401ks, they have timeshares, Roth IRAs, they have extra homes, cars, vacation stuff. I mean, like tractors, family businesses. I mean, it goes on and on, different kind of things that we can put in financial order. Tracy, you had a question?
Yeah, I think you might have answered some of them, but like we're working with an attorney an estate planning attorney right now and putting a lot of this kind of some of this peripheral stuff you're talking about in place, including I don't remember what we're calling it, a Medicare trust or a health trust or something for this. So for example, if I wanted to use your services to apply for this, could I just bring you my packet from my lawyer and say, here's how we're structured,
Hmm?
you know, can
Yes,
help me
you can.
apply for
Yes,
this benefit?
yeah, exactly. So, yes, you can if you want to, if you want to invite the attorney to be part of the initial consultation, you can do that, or you can just give us the information that what your attorney said, and because again, there's some things that we do that other attorneys don't want to do. And sometimes, oftentimes, they're not licensed to do the things that we're doing. So it would be a good idea, Tracy, to get a second opinion on what it is that you're doing. And it's a free consultation anyway. So I would say yes to you, do that. Why not?
And I'm sorry if I missed this in the beginning, or maybe it's my Parkinson's brain, but long-term Medicaid care. That's
Yes.
a benefit that they offer, correct? Is that
Yeah, it is actually long-term care Medicaid is a program. It's one of the Medicaid programs in the state of Colorado. But you guys,
okay?
there's like 40 different Medicaid programs. There's a lot, okay? But
Yeah.
this one is the only one. Again, that's why I was saying I want you to think of it over here by itself. That's the long-term care Medicaid is the only one that's going to help you pay for non-medical services in the home, assisted living, foster care, memory care, and adult daycare. So you have to qualify for this program. And it's not a given. Some people think, oh, my insurance is going to cover that. No, it's not. Or people think, oh, Medicare is going to cover it. No, it's not.
Yeah.
What other
Right.
questions do people have?
Yeah, that's what we're trying to plan for, or be prepared for.
Yes, good questions. For those of you that are caregivers, do you see how this could be beneficial? Just to take some of the pressure off of you. I mean, it was hard when I was a caregiver for my mom. It was hard. So please call my office. Let us walk you through the process. Um, I really wish I would have had more quality time with my mom at the end instead of trying to be a caregiver and a daughter. You know what I'm saying? Yeah, Jen?
Oh, I have another question about, um, so I don't qualify for the two daily living deficits or whatever, but I do need to have help around the house, probably about 20 hours a week of just, doing good, healthy food prep and that sort of thing. Where can I get help for that? I'm
So how is your
paying for it
stability?
now. I'm sorry.
How's your balance and stability?
Well, it's questionable. I've had a couple of falls, but
Okay.
I seem to function pretty well.
So, all right, I just want you guys to know this. When they do the health assessment, it is very important that you answer the questions as though nobody was around to help you. If you were to be left alone for a week, 2 weeks, a month, what would the situation look like? Are you bathing, dressing, toileting? Are you, what does it look like? Are you able to go shopping on your own? Are you able to like you're talking about food, right? You got to be able to sustain. And so it's important to not be the hero and, oh yeah, I can do all these things. I'm fine. No, you want to be honest, like you just said. I have fallen a few times. I'm having a hard time with my food preparation. I don't, I'm having a hard time with groceries, whatever, all those different things, because you have to be able to eat,
Mhm. What's
right?
the difference of eating like fast food as opposed to eating raw organic? You
There
know,
is a difference. Yes, there is, right?
yeah,
Yes,
so I
but
mean, it's
I
kind
would
of,
say, Jan, I would say this. I would still go through and the process, and let's just see what my when they go through it. It might be a pre-planning appointment, and they might wait to have you still wait, or and if they do, then you're planning ahead of time and you're prepared, right? Because
right.
this is progressive. All of you are going to need help in the future.
Okay, thank you.
Mhm. Jennifer, you've been quiet. You have any questions for me?
Um, I don't know because it's all a lot.
It is a lot.
Um,
That's why we do the free consultation, so that we can do this one-on-one with people and just focus on you and take it slow, walk you through what your situation is and help you and answer the questions, okay?
Makes
Because
sense.
it's a lot.
Yeah. So I don't think I have any questions. I don't think I really understand a lot of it.
So what you can also do on the screen still, see our website, this doinggoodforothers.com. I'm going to actually click on this. I'm going to show you guys something. See this frequently asked questions? I encourage you to go in there and read some of these frequently asked questions. You go through that, let me tell you, you're going to be smarter than most people. A lot of people get a lot of this information wrong. That's why we put this together. You can also, dig around here and then, learn a little bit more about us and our services. Our team, you can learn more about us individually. Anyway, and then if you want to book the free consultation, you can call our office or you can click on this and do it electronically if you want to. I encourage you to call our office so we can kind of walk you through and uh, asking the questions, But I just want you to be able to have something to read after we're done today, So, and you could see these are different appointments that are available. You can just click on any of them. This one's available at 2:30 with Nicole. You click on it, next, and then you just put in your information. Someone's going to call you back and confirm the appointment. It's that easy. I know everyone's busy, and I just want to thank you guys for taking the time to hang out with me tonight.
Thank you.
Yeah,
Thank you.
I want to be
Very
able to help you
informative.
guys as much as possible.
Yeah. And I will personally say, like I said, we're going through an attorney. We're in the process right now. We have half of this done and we've got anyway, but I have to just say that no matter who you go with or who you talk to, and I would definitely, Kim, will be calling your office because we're a caregiver. My father lives with us. He's 88 years old.
Oh,
There might be something that you guys can
yes,
help for us. But
yes,
I just have to say to the group that like in meeting with our folks that we're working with and signing those papers, I walked away and it was like, oh, okay. I felt at peace,
yes,
you know,
yes, for
knowing
sure.
that, like you said, all those myth questions that you had, I'm
Yes,
not going to have to get a divorce. Right now we own like 5 houses, rental properties. We have all this stuff, right?
yep. That's where
We had
we
this
specialize
complex
in.
thing
Mhm.
planned, and then Parkinson's came up.
Yeah.
And we just thought, oh shit. I mean, pardon my French, but it was like, there goes everything we've worked for. But
Right.
no, I now have some peace of mind
Yes.
going forward that I'm not going to have to force myself to work till I'm 70 while I'm sick.
Yes, for sure. Yeah, I would definitely say call our office and then we can see, what things and if this attorney's never heard of us, they probably want to know about us too. Yeah.
Yeah, we meet with him again. We finalize our stuff in a couple weeks, but I've heard your name before. I recognize the name of your company, but anyway, it does, aside with the fact that I'm working with somebody else, I'm just saying that it's peace of mind.
Yes. Yeah. Yeah. And it's always if you wanted to get a second opinion as well to make sure, because there's different rules when it comes to different trusts, and some work very well with Medicaid and some do not. So that's why I'm saying before you finalize everything, I would definitely encourage you, Tracy, as soon as possible, call my office and get in.
Yeah, yeah,
Yeah.
yeah, yeah. We have the other part of the trust is taken care of, like for the long term for the kids and all that. But the medical part of it, that is the one that he's working on right now. Um,
Okay.
so
See, and
yeah,
for the 88-year-old or 85-year-old, definitely we can help with that situation too.
yeah. I'm sorry to say he is somebody who didn't plan for anything. He had zero money and found himself not being able to live on his own, and was
Yeah.
forced to come live with us because we were literally it was either us or the streets.
Yeah. And we see that a lot. So,
And he's getting so that he's needing a little bit more and more care, and it's hard for me, you know, to be
yes.
able to give that because of my own situation.
Well, yes, for sure. Yes. Yeah. And that's too much. I mean, that's why I'm saying if we can come alongside you guys and get professionals to come in, it takes that pressure off the family.
Yeah, great. This has
Yeah.
been
I,
wonderful.
I
Thank
have to
you.
say, this is on, I work for the Parkinson Association of the Rockies, and I'm the Northern Colorado Outreach Coordinator, but my husband has Parkinson's, and one of my goals for this year, is to make an appointment with Beneficent in 2025 and to kind of start this ball rolling because I think it will feel really, like you said, Tracy, a weight off to just have
Yeah.
some things in place.
Yes, yes, yes.
Yeah.
I was so hopeful. I am so much more hopeful because we're looking at me trying to stop working. I turned 60 this in 25. I'd like to stop working. And I was dreading it because I had no clue as to what
Right.
that was going to look like.
Yeah.
Hoping I'm healthy for at least another 10 or 15 years, but there's other things in my life I want to do.
Yes.
I need to do them now. But I was freaked out because I just looked at my dad. It was like, oh, but we've planned, but are we going to lose everything? Is my husband going to have to be a landlord when he's 80?
Yeah. Yeah. Yeah.
So,
We can help you answer all of those questions.
Well, I think unless there are other general questions or more specific questions, I'm going to probably wrap this up. I did put an exit survey for you guys in the link, the chat feature. It's like 4 or 5 questions. If you have the chance, it really helps us with our programming to answer those. I will also send an email out probably by the end of this week at the latest with this video link to our website so you can rewatch it if you want because it was a lot of information. And I will send the exit survey as well with that. And if anyone needs any resources, that's a great time. It will go directly to my email. Since I'm emailing you guys, just let me know. I know there was some question about some resources. Just let me know. I gave my phone
Yes.
number, but
Oh, yeah.
an
Someone did
email
ask that
works.
question about the finding quality, trustworthy in-home help. Yes, you guys, we've got connections all over the state of Colorado. So yes. Or if
Yeah.
somebody needed placement, we can help with that. We don't do placement, but we've got connections for people, right? Yes, very important.
And that's the same phone number? The
Yeah,
719?
719.
Okay.
Go to the bottom of this. It's right. Where is it? Right here. 719-645-8350.
Yeah, you can call Beneficent. You can call the office at Par as well. Either way, we do recommend looking into all the resources at your disposal. I hear a lot of people say, I don't want to make use of that resource. I think I make too much money. And I'm like, man, it does not hurt to check.
No, that's where
So,
we specialize in is for people that do think that they make too much or have too much. You guys, it doesn't
exactly.
matter if someone if they think they're overqualified, $20. Or if they've got 1 million or 2 million in the bank, it doesn't matter. We can help them walk them through how to preserve the things that they work so hard and keep it in the family. So, all right, you guys, go have a great evening. Thanks
Thank
for
you.
joining
Yeah.
me.
Thank you, everyone. Have a wonderful evening.
Thank you.
Thank
Thank you
you.
so
Bye-bye.
much, Kim. We appreciate
You're
it.
welcome. Thank you.